My name is Dr. Brian Rogers. I'm the Director of Robotic Gynecologic Surgery at Jersey Shore University Medical Center. Pelvic pain as a whole is a complicated problem. There are many causes of pelvic pain. Typically, pelvic pain can be caused from adhesions or scarring in the pelvis. It could also be caused from abnormal processes that occur inside the abdomen called endometriosis, where cells that are typically from the lining of the uterus can spill out into the abdomen. One of the theories is that it can work its way through the fallopian tube and end up in the abdomen. When that occurs, it can cause an inflammatory reaction, and structures can start to stick together, and we call that adhesions, where the intestinal tract can become adherent to the uterus itself, or an ovary or fallopian tube can become adherent to the side of the abdomen, the uterus, or often the intestinal tract. Typically, these adhesions will end up causing pain either during or just before the menstrual cycle, or on occasion even throughout the entire month. At some point when pain gets to a level where it affects a person's daily living and their quality of life is affected, they'll seek care. At the time that care is sought, they will have an evaluation for infection, for possible endometriosis, and other possible causes including bowel dysfunction, and therefore colonoscopy would often be performed. On occasion, sources of pelvic pain can be related to the bladder, and a urologic evaluation would also be indicated, including cystoscopy, which is taking a look inside the bladder with a camera for any inflammatory processes that can cause pelvic pain. If the source of pain does appear to be coming from endometriosis or adhesions, in the past a laparoscopic evaluation to confirm this would be indicated. The surgeon would take a look inside with a small camera and use straight instruments to try to free up the adhesions, to separate them, to get rid of them, or to look for endometriosis and to treat those focal areas. Again, endometriosis can be focal areas where there are what we call powder burn lesions, where endometriosis has implanted and caused scarring in the area. If that is extensive to the point where laparoscopic surgery would increase the risk of complications to proceed, the decision is often made to stop, have the patient come back at a later time, and have an open incision done to complete their surgery. With current technology, such as the Da Vinci robotic technique, often these can be accomplished through the small incisions in one surgery, and the patient can still go home the same day. Endometriosis can often be fully treated. Adhesions can be approached more easily and safely, reducing the risk of injury to the intestinal tract, to the bladder, and blood vessels and nerves in the area. In addition, if more extensive surgery is indicated at that time, to fully treat these problems, including hysterectomy, which is indicated at times, this entire procedure can also be done robotically, and the patient would still be able to go home within 24 hours. Here at Jersey Shore University Medical Center, we're now able to offer the most advanced robotic techniques using the most advanced robotic platform called the Da Vinci SI that is offered in any community.